What if I told you 500 million people are struggling to breathe and the healthcare system is treating it like a gym problem? Not a trauma problem, not a brain problem, not a cultural problem. Just do your breathing exercise and see you next week. That's broken. Hey there, if you're new here, I'm Dr. Devi Sundar and I wrote this book, Breath Beyond Illness. Today, I'm breaking down my book that flips the script on chronic lung disease like COPD, asthma, and ILD, which stands for interstitial lung disease, and show how an overlooked trillion worth of healthcare gap is hiding in plain sight. A 2023 macroeconomic modeling study estimated that COPD is the third leading cause of death globally and imposes a massive economic burden estimated at of 4.3 trillion from 2020 to 2050. High income countries face higher economic burdens related to their GDP because of higher workforce education and treatment costs. Investment in public health policies and COPD intervention can yield substantial economic returns and improve population health. Moving out of that important paper published in 2023, and when we look into the systems that's treating chronic respiratory disease today, it's still measuring lungs, not lives. If you have chronic respiratory disease like COPD, asthma, or interstitial lung disease, you would have got used to this script. Take your inhaler, do pulmonary rehab, build stamina, try harder. Most pulmonary rehab programs still stuck in 1995. But here's what I saw working with patients. Two people, same lung function, same diagnosis. One lives fully, the other is trapped in fear. Why? Because breathlessness is not just mechanical. Breathlessness is processed in the fear centers of the brain, like the amygdala and insula. Breath is primal. When you can't breathe, your brain doesn't say, oh, it's mild airflow obstruction. It says, you're dying. Your amygdala lights up, your insula amplifies the signal, and your nervous system goes into survival mode. And if you ever add trauma, panic, chronic stress, or anxiety, that signal gets louder. And all of these changes the way how you experience oxygen. So your breath is neurological, psychological, cultural, and human. But we have built entire rehabilitation system many years that ignores this. Traditional pulmonary rehabilitation says, here's a treadmill, walk. That's like giving someone with PTSD a Fitbit and calling it as a therapy. And then we wonder why dropout rates are high. It's not laziness, it's biology. Why does it fail? Because program ignore mental health, cultural identity, language barriers, digital access. If you're a woman in a conservative household, if English isn't your first language, if you don't feel safe in mixed gender classes, you don't show up. And when people don't show up, outcome tank. This isn't a compliance issue, it's a design issue. We obsess over designing the clothes we wear or the apps we use. But chronic respiratory disease remains as a silent illness. No dramatic headlines, no viral campaigns, just slow decline, stigma, misdiagnosis, isolation. And when people drift out of care, we label it non-compliance. I call it system failure. I didn't write Breath Beyond Illness to critique system. I wrote it because patient kept telling me the same thing. No one is treating the whole of me. So I built the psychosocially integrated pulmonary rehab model, PIPR. It has 4 pillars: psychology, culture, digital access, interdisciplinary care. Translation: stop treating lungs, start treating humans. So what I mean by that, include trauma-informed care in the management of chronic respiratory disease, integrate mental health support at early stages, and design culturally responsive programs, and responsibly integrate hybrid digital rehab programs for people who can't travel, considering their literacy levels. It's simple and radical because it requires healthcare system to admit it has been solving the wrong problem. We stop treating lungs in isolation, we start restoring agency. Because whenever I see massive underdeserved population and outdated systems and tech gap, I see the opportunity. Let me explain. The healthcare industry in the management of chronic respiratory disease loves metric. FEV1, which stands for forced expiratory volume in per second, oxygen saturation, and 6-minute walk test. These are the very common metrics and kept as a key performance metrics in the management of chronic respiratory disease population. Ailing breath is not improving a spirometry score. It's breathing without fear, walking without panic, climbing stairs without shame, feeling safe in their own body. Breathlessness attack identity. People stop traveling, stop socializing, and stop dreaming. Pulmonary rehabilitation for many years have focused on improving people's physical endurance. But hearing me now, you would have understood breath is beyond illness. It should not focus only on the physical aspect, but psychological, cultural, and human. So focus on rebuilding dignity. there is a difference. So I'm looking for a collaborator for this new project, and I would welcome collaborators from wider world. And you can contact me on this email, sdevi@tele-therapies.org. I'll drop this email in the description box so you can have it there as well. So by now, I hope you understood breath is a thread connecting your body and mind. When we separate them, the care fragments. When we integrate them, people heal differently. The future of chronic illness care isn't more about missions, it's deeper about the humanity. Psychological integration, cultural humility, digital inclusion, and community collaboration. That's not soft medicine, that's smarter medicine. So here's the takeaway. If you're in healthcare, rethink the model. If you're building in health tech, look into where the drop-off rates are high. And if you're a patient, your breathlessness is not just in your head. Your experience is real. Even if your scans look stable, and even if someone told you it's just anxiety, but your head does matter. Healing isn't just rehab, it's dignity, agency, and belonging. And that's a way bigger conversation than oxygen levels. If you want more breakdowns of broken systems hiding massive opportunities, hit subscribe, because the next frontier isn't just about tech, it's redesigning care around humans, and that's where the real upside is. Remember, breath is biological, emotional, and social. We cannot rehabilitate the lung without honoring the person breathing through them. That's why I wrote this book, Breath Beyond Illness, because beyond illness, there is still life, and it's worth fighting for. And please hit the subscribe button so this message can reach many people, because more awareness means more change. Together, we can redesign the care around humans, not just lungs. Until my next video, stay healthy and stay curious. Signing off, Dr. Devi Sundar.